Welcome back. You with the Newsfeed. All right, plenty to talk about with the Health Minister, but also COVID-19. No certainty yet from the Food and Drug Administration in the US around the Johnson & Johnson vaccine doses. Some of them are being stored here. They could be used to vaccinate people. They could be used to vaccinate you or your parents. The American FDA inspecting the facilities of a supplier to Johnson & Johnson. They placed a temporary halt on the doses. You'll know, of course, 4 of our 9 provinces are in the middle of a third wave of COVID-19. Dr Michelle Groome is at the NICD, the Division of Public Health and Response. Dr. Groome, good afternoon to you. I mean, I don't know about you. I search Twitter every morning looking for the FDA to make their decision, and still nothing.
Yeah, I mean, we really are. I think there were some indications that this would come towards the end of last week, and we never heard anything, and then kind of early this week, and now it's already Tuesday. So I think this really does have implications. Obviously, we have some Pfizer doses on hand, which are being rolled out, but I think we are relying on the Johnson & Johnson to be able to kind of move forward timeously with our vaccination program. So definitely relying on them to come forward, obviously, with clearing the vaccine.
It would make a huge difference to us if it is cleared, and I understand the clock is ticking as well. Some of the doses we have might actually expire.
Yeah, so I think there was, they were going to make provision for some other doses as well to become available, because obviously we would need to still fill and distribute the vaccine, some of the doses that would be filled. It was in South Africa, and there was talk of providing some additional doses. But yes, I think those with very short kind of expiry date, which would need to be used fairly quickly. So I think we're all obviously waiting for something at least to happen sooner rather than later.
And the SA Health Products Regulatory Authority, I mean, they're in a sticky position as well. I mean, I can imagine someone will say, well, never mind the FDA, they don't have jurisdiction over doses here. But no one wants to make a mistake with this kind of thing.
Yeah, and I think because, it's to do with the vaccine production, I think it does have implications in terms of, any vaccine doses that were produced in the US. So we're not producing our own, so those were sent here. So we would need to, I think, rely on the FDA releasing, those batches.
We need to talk about the number of COVID-19 cases. We had 3, maybe 4, maybe 5 days of over 5,000 new cases being reported every day. Then in the last 24-hour period, I think it was around 3,500. I know you're about to give me another lesson in the phrase 7-day moving average. What does that tell us?
No, yeah, it's increasing. So I think the only reason we really speak about that is as you see, yesterday's obviously reflecting mostly cases on the weekend where people tend to test less. So definitely, I think the worry at the moment is really Gauteng. I mean, we've been seeing in the last couple of days where, of the daily case count, over 60, I think it was around 60% yesterday that were actually coming from Gauteng. So I think Gauteng seems to really, be seeing the contributing the most to those increasing cases. We've got some early indications that in the Northern Cape and Free State that seems to be leveling off, and some indications of slight decreases there. But definitely Gauteng is the worry at the moment.
It's sort of difficult to know how all of this is going to play out. I've heard one epidemiologist say that if we took the right course, we could possibly save 20,000 lives over the next 2 months. I mean, that's quite a big thing to say. It does seem that this third wave is moving, I don't know, slower than the first and second?
Yeah. So there definitely are indications that it is moving slower. So the rate of increase is slower than what we've seen with the others. And most likely explanation is that, there are a lot more people who have been exposed in the other waves, and so there's more population immunity. Obviously, it's not enough to stop the spread, and that we may be seeing certain districts and even provinces that weren't as affected in the other 2 waves that are now seeing increasing cases. So very difficult to predict what's going to happen and to make these type of projections. Definitely the modeling group is trying to put together some short-term projections, especially to be able to help with, hospital capacity and trying to predict, which districts and which hospitals may need support in the coming weeks, especially in Gauteng, with the increasing cases.
And I mean, Gauteng again, it's cold in Gauteng. Trust me, yeah. I know. No one's going to open
I'm
windows.
here as well.
Yeah, no one's going to open a window anywhere.
Yeah. I think there's obviously a number of factors that are different this wave compared to the last wave. I think definitely last wave was summer, much easier to be outside. rightly so. I think in the winter now, no one really wants to sit with all the windows open. They rather want to sit around the fireplace. I think also different is with the schools being back, with varsities being back. I think that's been a different dynamic as well, where we've seen quite a lot of school clusters and clusters in the varsities. So the dynamics are very different, I think, this time round.
You talk about Gauteng, and I mean, of course we do, because it's so densely populated, the highest population. It seems so interesting to me that 4 of the 9 provinces are in a third wave, and there's a mathematical sort of threshold. Do you expect the other provinces automatically to go through a third wave? And I ask that because in the past, like the Northern Cape, you know, was the one place that didn't have strict regulations during the summer because it didn't really have nearly as many cases during a second wave. So I suppose what I'm really asking is, can the other provinces be saved from a third wave?
Well, we don't know is the, the easy answer. I think there are some indications. Look, the Western Cape did have a fairly severe second wave. There are some indications now that cases are going up in many of the districts there. Nelson Mandela Bay is also starting to increase, and obviously those were ones that were impacted quite early on in the second wave. We don't know. I mean, provinces like KZN are not seeing increases. They were very severely impacted in the second wave. So I think it's a bit early to say. I think we're also worrying, I think, with the universities and you know, going on break, you know, in the next couple of weeks. I think that, you know, if there's travel to other provinces, potentially, you know, that could also lead to spread. So I think too early to say, but there is the potential that those provinces have much higher underlying immunity and may see lower kind of third waves.
Dr. Michelle Groome, I really do appreciate the time. Thank you very much indeed from the NICD.